and that's a rash called livedo reticularis. So it makes sense to me that this is some sort of toxicity-related phenomenon, that it would be improving with the cell membrane therapy, and I'm glad that it's clearing up and you're feeling so much better.
Me too.
So when my dermatologist told me that it was most likely obsessive-compulsive disorder and that I just needed handcuffs as my treatment, it made me feel extremely upset and confused, because that was not what was going on, and I just felt like he was very dismissive of my symptoms and gave a mental diagnosis, which I thought was very unusual for a dermatologist to make that kind of psychiatric diagnosis on a patient. And he told me that he was aware of Morgellons, that it had been brought up at dermatology conferences, and that there were some dermatologists that would get up on their platforms and really be very outspoken with their opinions that the disease was real, but the majority of dermatologists believed that it was just a type of delusion that the patients have. I don't think that most doctors realize the impact of having a diagnosis of being delusional. Some patients have lost custody of their children, have lost their jobs, they've lost their spouses through this because their spouses didn't believe them or were not willing to stand by them. I've heard of multiple patients committing suicide. I've heard so many tragic stories that I think that really inspired me to find a way to heal not only myself, but help heal others.